Feeling a little bit better?
Yes, and thank you for.
You're welcome.
Thank you very much.
Just sit back, please, and relax and follow the other admonishments. And once again, do you acknowledge you're still under oath?
Yes.
And still sworn to tell the truth?
Yes.
Thank you. We're going to have a resumption of direct examination. Mr. Chernoff, good morning.
Good morning. Thank you.
You're welcome.
Miss Lee, you never did tell us, how did you get into this nutrition consulting and nutritional business?
I got into the business. I had taken classes through the Clayton School, which was an online program in the 80s, and obtained my PhD in nutrition and holistic medicine in the 80s, and that's how I got into the business. I also attended many courses and classes through ACAM, which is the American Academy of Advancement in Medicine, many classes where they teach you more in depth on IV nutrition. I recently attended a course through another compounding pharmacy that teach classes on IV nutrition also. So I've been certified in IV nutrition through the top major schools in advancement in medicine.
Are you a big believer in holistic medicine?
I certainly am. I wouldn't be here.
I'm sorry, what was your last comment?
I wouldn't be here if I didn't believe in it. Health-wise myself, I'm sorry.
Oh, I understand. Tell us why you're a big believer in holistic medicine.
I'm a big believer in holistic medicine, and one reason is because I have had medical challenges myself. I'm currently a grandmother of 8. Because I do what I do, it's anti-aging, and it keeps you feeling well, as I was able to bounce back here like I did. At age 7, I was scheduled to have both my legs amputated from eczema, and I have a great passion for people who have problems with eczema. And at age 7, I wanted to, because there was one doctor when I was ill, out of a team of 7, who stood out and said they were not going to amputate my legs. And I always felt from that time on, I want to be able to give back to others with this doctor who was a physician who gave back to me. So I kind of started my journey in wanting to be a blessing and help others. And then I've been in 2 comas in the past. The last coma was in 1992. And after that, I said I really am going to do more and more research, because I personally don't feel anyone should have to suffer or be ill. And I know wholeheartedly that you don't have to. So in my practice, the one thing that we do is put God first.
Miss Lee, I would like to talk a little bit about April of 2009.
Yes.
Are we okay with doing that?
Yes, we are.
Okay.
Mr. Chernoff, I think we're having a mic problem. What else is new around here? So once again, Deputy Jones, please.
Want me to tap it, Jason?
I'm expecting an internal solar eclipse, ladies and gentlemen. Thank you.
Okay, let's go back to April of 2009. Okay.
Yes.
May I show you a part of your medical records? Judge, would it be okay if I showed Miss Lee part of her medical records? I believe that's where we ended off last time.
Mr. Walgren?
No objection, Your Honor.
Certainly. Just let counsel know.
I'm going to show her the 19th, Tuesday. Okay.
Yes, please.
I want to show you April 12th, which is part of your medical records. Does that look familiar to you?
Yes,
Do you
I
have
have
that?
it right here. I'm ready.
Okay. And you have April 19th?
Yes, I do.
Okay. Very
I'm
good.
ready.
Thank you. When you were testifying yesterday.
Yes.
Yesterday. You were talking about Easter Sunday, and we were talking about you spending the night at Michael Jackson's house. And I want to kind of clear the dates up. I want to make sure we get the dates right.
Yes,
Okay?
and so do I. Thank you.
Okay. April 12th was an Easter Sunday, is that right?
Yes.
Or at least on your records you show it's an Easter Sunday.
Yes.
And you went out to Michael Jackson's house,
Yes.
and he told you that he needed products for sleep, but without specifying those products. Is that right?
Yes.
Okay. And then on the 19th, you went out again to his house?
Yes.
Okay. A week later, that was also a Sunday?
Yes, it was.
It was. And this was a morning appointment,
Yes.
and he told you again, I just can't sleep.
Well, I was actually there on the 19th of the morning is to prepare a smoothie for him and to give him a B12 shot, and that's in my notes.
Okay. And what did he tell
And
you?
he did bring up the fact that he's having a lot of difficulty sleeping.
Okay. And then he brought up the idea of you to come and stay with him that night,
Yes.
and you agreed
Yes.
to do that. And he wanted you to do that, he said, because he wanted to show you that he was unable to sleep.
Yes.
And he told you that he had sort of a maybe 2 to 3 hour pattern of sleep, and then he would wake up.
Yes.
Is that what he told you?
Yes, he did.
Okay. And you did stay there that
Yes,
night?
I did.
At some point during the evening, we really didn't nail down the time that you went up to the room, but would it be fair to say it was sometime after 11?
Yes.
Okay. And you reviewed your medical records?
Yes, I have.
Okay, great. You also, at some point during that period of time, after you went up to his room, he addressed with you this issue about sleep again, did he not?
Yes, he did.
And he talked to you about his need to be knocked out, his need to use a particular drug?
If we can go back a little bit, I'm sorry, on the 19th, before I went to see him that night, I actually saw him that morning.
Right, I believe that you did say that.
Okay.
And is there something about that you'd like to add, Ms. Lee?
Yes, because it was the morning. No, I've covered it. I'm sorry. Thank you.
Okay. Well, just stop me anytime if there's something I leave out, okay?
Okay.
That evening when you went up to his room after 11, was there at some point that Michael Jackson discussed the need for a particular drug or desire for a particular drug?
Yes,
Okay. And what drug was that?
it was Deprivan.
Diprovan.
Really, I still need to go back because that happened that morning. I get thrown off in timing like this. Deprivan came up actually in the daytime because it was the 19th in the daytime. In the morning is when he brought it up, and we went sort of back and forth about it because I didn't know what it was.
Was that morning he brought it up?
The 19th.
Okay. You didn't know what Diprovan was?
No, I did not.
Okay. And then he asked you to come back that night?
Yes.
Okay. Did he further discuss what Diprovan was with you or why he thought he needed that on the 19th, that morning?
Well, can I back up a little bit, please?
Yeah.
Well, no, there's a question.
Oh, I'm sorry.
So
Okay, please.
you can
I'm
answer
sorry.
that question, and then counsel can go further. So do you want the question re-asked, or can you answer?
Yes, please. Can you?
Was there a conversation that morning about Diprovan? Did you have a conversation with Michael Jackson?
Yes.
Would you like to tell us, please, what that conversation was about? What you talked about?
The conversation, when he asked me, he said, I have a lot of problems sleeping. The only medication that really helps me to fall off to sleep right away is Deprivan.
Did he tell you why he had trouble sleeping? Did he ever tell you about that?
We went through, during the time we had spoke about just about everything possible that was natural to help him to sleep. And also during this time, I discussed with him, sleep hygiene. This is what he made a comment about coming back that night Because I said, well, maybe your room is too much lighting, maybe you have too much frequency, electronic frequency or frequency around your head, which will also interfere with sleep. And I said, I need to see if you have, a phone near your head, too much lighting, too much interference with the outside environment. And so basically wanted to deal with, see what's going on with sleep hygiene. I also had a videotape that was from one of the doctors at a seminar I had attend on sleep studies and sleep hygiene, and I had taken that with me too. And I wanted him to see, and that's kind of referenced in my notes also.
Ms. Lee, I want to back up and re-ask the question. Did he tell you why he was unable to sleep when you had this conversation on the morning of the 19th?
He did not tell me why he could not sleep. He just had problems sleeping.
Okay. The video that you're referencing, that you talked about, did you bring that on the 19th, or did you bring that later?
I brought that later.
Okay. So to characterize your conversation with Michael Jackson, it was, I can't sleep, I need Diprovan. You then went into possible reasons why he couldn't sleep, right?
Yes.
And the reason for that is you wanted to try to help him.
Exactly.
Right? Did he seem pretty... What was it? How did he appear to you when he told you that he needed Diprovan? Did he seem desperate? Did he seem matter of fact? What was his emotion that he was portraying when he said that?
His emotion, because he was sitting very close to me.
How close? How close?
From about here to where her computer is sitting, so it wasn't that far away.
Just the
3
two?
Thank you.
3 feet? Just the two of you?
Yes.
Okay.
And he looked at me and he said, I have a lot of difficulty sleeping. I've tried everything, and what I need is something that's going to help me fall asleep right away. And then he went more into, the only thing that would do that is Diprovan.
When he told you that, did you know what Diprovan was?
No, I did not.
Never heard of it?
Never.
Okay. Was that a concern to you, this conversation, him telling you this?
Yes, it was a concern.
Did you further have during the conversation, did you believe that he had received Diprovan in the past?
Well, I didn't know what it was, so I didn't know if he had received it in the past.
Did he seem to have a familiarity with it?
Yes.
All right. So you eventually agreed to come back that night, is that right? Did you agree
Yes.
to come back that night? Okay. And in the interim, you researched what it was, isn't that right?
Yes.
Okay. To learn what it was.
Yes.
And you called doctor?
Yes.
And was that the doctor you're associated with?
No, I associate with a lot of doctors, so I called, because it was on a Sunday. I didn't call the doctor that's on the paperwork there, because it's hard to reach him. He's usually in church on Sundays. I did call someone who was a physician, and I asked him, what is Diprovan? And he explained to me what it was. It was an anesthetic used to, for surgery, sometimes used in ICU. And I said, so it's never used at home? He said, absolutely not. And so I...
Did you do more than just talk to this doctor?
No, that was it. He just told me what it was, and I was off the phone with him.
Okay. Then, armed with that information, you went to talk to Michael Jackson?
Yes.
And what time did you go back to the house on the 19th of April?
Well, can I just say this first?
You can answer the question.
Okay.
What time did you go back to the house?
I was still at the house.
Oh, when you were making the phone call?
Yes.
And where was Michael Jackson when you made the phone call?
Michael Jackson was in his bedroom. I stepped out of the bedroom and went outside to call the doctor because I had kind of a poor cell phone, and so I had to step outside to make the phone call to the doctor, and I went back upstairs.
Okay. And this is during the day?
This is during the day.
Okay. And then you came back in and told Michael Jackson what you
Yes.
had learned?
Yes.
And you told him all that the doctor had told you?
Yes.
Okay. And did that seem to satisfy Michael Jackson? Did he agree with you?
No.
What did he tell you?
He told me that doctors have told him it is safe. And he would not have a problem. He said, doctors have told me that it's safe. I just need to be monitored. I said, well, no doctor is going to do this at your house. He said, no, I just need somebody to come here, and I will be safe if it was monitored, as long as I'm being monitored.
At what point during this conversation did you agree, did the two of you agree for you to come back that evening, or did you stay all day?
No, I left, and I told him, well, let's just try your nutritional IV one more time, try it again. And, I'm going to bring some other supplements. This is on a Sunday. So I went to my office, and since he was trying to convince me that doctors have told him that it's safe, I went to my office to get my PDR, which I brought with me. And when I went back that evening with Michael, with his other nutrition, I showed it to him, the PDR.
Did he ever tell you during this period of time that he had been administered this in the past?
For surgery, he did.
Did he ever tell you he had had it administered for anything else?
No.
Okay. What did he tell you about his experience with surgery?
He said, when I was having the surgery, and I kind of went back to what happened to him with the surgery years ago, and he said, I woke up, and I didn't even know that I was asleep that long. He said, I had fallen asleep so easily, and I want to have that experience again. I want to be able to fall asleep easily so that I can get enough rest, because I'm in the midst of doing a lot of work right now, and I don't want to take something that's going to cause me to keep me up for hours. I want something that's going to help me to sleep right away. And based on, his experience from the surgery, he said, I know this would knock me out. As soon as it gets into my vein, I am knocked out and I'm asleep.
Is this, Ms. Lee, what you're testifying to, is this based on your memory of the events from April 2009? Or is it based on medical records?
It's based on medical records.
Okay. Well, could you please go to the part of your medical records which discusses what that part of the conversation?
I actually don't see it.
You have thought about this for 2 years, haven't you? I mean, every day you think about this, don't you?
Have I thought about this for 2 years, every day?
Yes. I mean, is this something that you think about frequently?
I don't think about this every day for 2 years. I
Okay.
have not every day.
Okay. So when you testified yesterday, you talked about that Michael Jackson slept for 4 or 5 hours. You remember saying that?
Yes.
And you have reviewed your medical records, right?
Pardon?
You have reviewed your medical records. And in your medical records, you talk about approximately 3 hours later, he woke up. You remember saying that?
Yes.
Okay. I want you to try to remember, as best you can, whether or not Dr. Murray was ever mentioned in this conversation?
No.
Dr. Klein was ever mentioned in this conversation?
No.
Did Michael Jackson ever mention any specific doctor to you?
No.
No. Okay. Did he ever mention to you how long he had had this problem with not being able to sleep.
He said it had, when he's in rehearsal or in, planning for a concert, because he puts so much energy into what he's doing, that it's hard for him to just turn everything off and go to sleep at night and just fall asleep. And he said it's basically when he's planning a rehearsal.
Now, on the 19th, after he woke up, what kind of, did you have a conversation with Michael Jackson?
Yes.
Okay. And what was that conversation about?
Well, he wasn't very happy that he didn't sleep longer.
Was he upset with you?
Yeah, he was a tad bit upset. He wanted to sleep longer, and he said the nutritional components were not working.
And this was, did you happen to mention the drug Diprivan again after he woke up?
I don't remember. I would have to look at my notes. Yes.
What did he say?
He said, I'm telling you, the only thing that's going to help me to sleep right away is the Diprivan. And can you find someone to help me to sleep? And that was the 19th, April 19th, that evening. Well, probably early that morning by then.
And ultimately, he got up. Michael
Yes,
Jackson
he did.
got up.
He got up.
And he complained that he was complaining when he got up. Is that right?
Yes, he was.
What did he say?
He said, now that I have not been able to sleep all night, this is going to mess up my performance from the day. He said, the only thing that's going to help me is Diprivan, and this is not working.
And then he gave you a hug, and you
Yes.
left.
Yes.
Did you ever again see Michael Jackson?
No, I did not.
Did he ever call you to come out to the house again? Michael Jackson himself?
No, he did not.
Did you ever go back to the house?
No, I did not.
All right. But if he had called you, you would have?
For
Right.
nutritional support, yes.
Okay. I want to fast forward from the 19th of April. I want to take you to June 21st, 2009. This is 2 months later. Okay? You do not have any medical records
Oh,
to reflect
I'm sorry.
that, so it's okay.
Thanks.
Do you remember on June 21st, 2009, getting a call from Fahim Muhammad?
Yes.
Okay. And do you remember what time you received that call?
No, I don't know exactly what time it was. It was that morning of,
Of June 21st.
yes.
And do you know the purpose of the call? Do you know why Fahim was calling you?
Fahim, no.
Okay. He just called you out of the blue? He called you out of the blue?
He called me because he said Michael wanted to see me.
Okay. And was it your impression that Michael Jackson was with Fahim Muhammad?
Yes.
I'm sorry? The objection sustained. The last answer stricken. Disregard, please.
Why do you believe? Do you know that Michael Jackson was with Fahim when he called?
Yes.
Okay. And how do you know?
I can hear Michael in the background.
Okay. What did you hear Michael in the background saying?
He was telling Fahim, tell her what's wrong with me. Tell her what's happening with me. That one half of my body is hot and one half of my body is cold. And I was out of state at the time. I was in Florida. So I told Fahim, I don't know what's happening with him. I'm too far away. He needs to just go to the hospital. Call 911. I didn't say 911. He just needs to go to the hospital because it didn't sound like a lot of distress. He just said, one half of my body's hot, one half of my body is cold. So I just told Fahim he needs to take him to the hospital. Someone needs to take him to the hospital. He needs to go to the hospital.
And that's what you told Fahim to do?
I told Fahim that someone needs to take him to the hospital.
Okay. And why did you tell him that? What was your concern, Ms.
My
Lee?
concern was on the 19th of April of '09, when I had taken my PDR and gone to the page of all of the symptoms and side effects of propofol, and he had to be in the hospital and be, it was not a sleep aid in the first place. I went through a battery of symptoms in the PDR, and I just kind of felt maybe he realized maybe some of the symptoms, or I really don't know. But I told him he should just go to the hospital.
Do you recall speaking to the police about this event? Do you remember talking to the police about this event, June 21st, 2009?
I believe so.
Okay. Do you remember telling them that you thought that your opinion was that Michael Jackson was under the influence of a central nervous system depressant?
No, I said the symptoms that he had stated. I said, I don't know what's going on with him. It could be a central nervous system problem, and I'm too far away to assess what's going on, so he needs to go to the hospital. I did not say he was on anything.
You never. I'm just asking. At what point did you come to the conclusion that it might be propofol that caused this?
Well, I didn't come to the conclusion. I remembered going through the symptoms in the book, in the PDR, and noticed that that was one of the symptoms that I had already gone through with Mr. Jackson.
The reason I ask is because you had a conversation with the police on July 9th, 2009. Do you remember that?
Yes.
And your response was you believed that he was on something that had introduced into a central nervous system. Do you remember telling him that?
No, I don't.
Do you have any information? Did you have in July any information about drugs that Michael Jackson had been taking?
Do I have information of any drugs he had been taking?
No. I'm asking you in July of 2009 when you made this statement. Did you have any information about drugs that Michael Jackson had been taking?
No.
Did Fahim Muhammad tell you anything about drugs that he had been taking?
No.
Okay. So you had no idea?
No.
Okay. All right. Okay.
Double negative. Did you have any idea?
No.
Thank you.
Thank you, Ms. Lee. Appreciate it.
Thank you.
Chernoff, thank you. Cross-examination by the people. Mr. Walgren?
Thank you, Your Honor.
You're welcome.
Good morning, Ms. Lee.
Good morning.
How long have you been a nurse practitioner?
Since about 1982, around the 80s.
And how long have you studied, or when did you get your PhD in, I believe, was it in holistic medicine?
It was holistic medicine,
And
Clayton School. It was an online program that I did my training from.
And what year did you get the degree?
I'm really not great with all my dates. It was in the 86,
Okay.
about 86.
Thank you. Now, when you first started trying to help Michael Jackson, I believe on February 1st, 2009, you'd gone out because the kids had cold-like symptoms.
Yes, I started with the kids in January 29th. That was my first time going to Michael's house.
Okay, and then you went back the following day, February 1st, 2009, to offer some of the vitamins and nutritional assistance to Michael Jackson.
Yes.
And you've documented and maintained medical records in regard to your care of Michael Jackson,
Yes.
and you did a fairly extensive workup as far as Mr. Jackson's general health at that time when you first met with him on February 1st, 2009.
Yes.
You noted in your documentation some medical history, for example, that he had lupus and vitiligo.
This is what he told me, yes.
You noted that very early on in your encounters with Mr. Jackson, one of the things you noted as a problem for his sleep was that he consumed a very large amount of the caffeinated beverage Red Bull, correct?
Yes.
And you would see these Red Bull cans lying out in the open, plain to see. I mean, it was obvious, correct?
Yes.
You also noted that he, at some point during your care and discussions with Mr. Jackson, that he would go to sleep with the lights on and music on and movies on from time to time, and this was an obvious indication of something that needed to be remedied for sleep, correct?
Yes.
Now, in this initial February 1st meeting with Mr. Jackson, you filled out forms and you kind of took again the general health survey. You asked questions about his health. You documented everything in your records in that regard.
Yes.
And you also learned in that initial encounter, and I think Mr. Chernoff had asked you about this, that during concerts or when he was performing, he would lose a lot of body fluids, and you actually note, quote, people would have to mop the floor from sweating.
Yes, that's what he said to me, yes.
And in this February 1st encounter, do you have your progress notes from February 1st, 2009?
Yes.
May I approach the witness to reference a particular page, Your Honor?
Yes.
I'm looking at this. At the top of your progress notes dated February 1st, 2009, do you see where I'm referencing here? These numbers at the top of the form?
Yes.
On the overhead.
Yes. What are those, please?
Those are his vital signs.
So in your first meeting with him, you took all his vital signs and noted them in your progress notes?
Yes.
And going across the column, what vital signs did you note?
His blood pressure. You want the numbers?
No, just what did you note? What are
Oh, his blood pressure, his pulse rate, his respiratory rate, his. I didn't do a temperature on him. Actually, I didn't weigh him. I just asked him his weight.
Okay. And you documented those vitals in the notes.
Yes.
And during this initial meeting, you also made the determination then to pursue, well, at the bottom of that page it says plan, and one of the plans was to pursue blood work or lab work.
Yes.
And why was that?
Because he wanted to start a nutritional program, and I needed to find out where he was with his health. And I also wanted to find out, because I think it was, well, I just wanted to find out where he was with his health.
Okay.
So it's important to do lab work first.
And you did draw blood,
Yes.
and that was difficult to do because you had very small veins, correct?
Yes.
And again, as part of your plan on this very first encounter of February 1st, 2009, you advised Mr. Jackson to discontinue all the caffeinated Red Bull drinks so that could help him sleep.
Yes.
And eventually, you, on a future date, you're able to get the lab results with a detailed analysis from the laboratory, correct?
Yes,
And you're able to go through those lab results with Mr. Jackson?
yes, at great length. We had a long, comprehensive visit to go over the lab results, yes.
And you have, again, just going through your medical records, you have progress notes for the following day of February 2nd, 2009?
February 2nd?
Yes.
Yes,
You have progress notes for February 3rd, 2009?
yes,
And again, in each of these notes, you're documenting his complaint, if any, present illness, if any, your findings, your impressions, your recommendations. You also list if there's going to be a future appointment, things of that nature, correct?
yes,
February 16th, you document all of this in a progress report, again noting his blood pressure, is that correct?
yes,
And on February 16th, you also note in your progress notes section, you discuss the lab results. Is that right?
yes,
And at the bottom of that page, you again note the continuing plan that he needs to discontinue the Red Bull drinks.
yes,
And were there two separate lab screenings you had performed, or just one?
2.
And why was the second one done?
The second one was done because I set him on a treatment plan based on the outcome of his lab work, and I wanted to see how effective the treatment was,
All right.
and everything had gone to normal
So there had been an improvement.
greatly.
And this was through your advice of discontinuing Red Bull drinks, giving him vitamins, and following up on his nutritional needs.
Yes,
And your notes continue then, for example, March 9th, 2009, there's a progress report where you note some of his vitals, correct?
I'm sorry, what was the date again?
March 9th, 2000?
Yes,
And again, it's the same form where you summarize on that day the complaint, any illness, findings, impressions, and recommendations as to future plan for good health.
yes,
And on that day, going to your progress notes of March 9th, 2009, it notes lab results from March 4th, 2009, consultation for lab results. So is that the day that you again went through these lab results with Mr. Jackson?
yes,
And did your care of Mr. Jackson in this regard continue after that day?
yes,
Going to March 13th, 2009? Do you have your progress note in front of you
Yes.
for March 13th?
I'm keeping up. Yes,
Okay. Again, chief complaints, present illness, if any, your findings, impressions, and what the ongoing plan or recommendation is all documented in your medical records?
yes,
March 16th, same progress note form. You note that no complaints, quote, feels good, and you note the recommendation for further vitamins, the Myers nutritional cocktail, and further nutritional supplements. Is that accurate?
yes,
And this documentation continues through March 20th, 2009,
Yes.
March 24th, 2009,
Yes.
conversation is when he began to tell you about this medicine that he called Diprivan, which you now know to be propofol.
Yes.
And this is all documented in your medical records.
Yes.
And then, so you had not heard of Diprivan or had utilized it in any way at that time, correct?
No.
Have you ever used
Excuse me, that's correct?
Oh,
That is correct statement that I made?
I had never. Can you repeat it,
Let me
please?
repeat it. You had never heard of propofol or Diprivan at that time?
No.
Okay. And you've never used...
Well, it's a double negative. That's the problem.
Had you ever heard of propofol or Diprivan at that time?
No.
Okay. And have you ever used propofol or Diprivan at any time?
No.
And so when Mr. Jackson expressed an interest in Diprivan, you had to research it and get up to speed on it.
Yes.
And so you made a telephone call initially? Is that accurate?
Yes.
Okay. And you found out that it's something that's basically used in hospitals for surgery?
Yes.
And in your notes, you explained that at that time, you advised Mr. Jackson that this was a medication he didn't want to use because it is not a sleep medication for insomnia. It's only used in the emergency room or an intensive care unit,
Yes.
and that it was not safe to use at home.
Definitely.
And Michael Jackson responded to you saying he assured you that he would be safe. He only needs a doctor to monitor him while he sleeps.
Yes.
And then my understanding is after this initial conversation, you left Mr. Jackson's home to go retrieve your physician's desk reference to get additional information about propofol or Diprivan. Is that correct?
Yes.
And then on that same day, April 19th, returned to the home. Did you have your physician's desk reference with you?
Yes, the one that I brought here.
And did you show it to Mr. Jackson?
Yes, I did.
And did you explain to him the side effects of propofol and Diprivan?
Yes.
And in the physician's desk reference, it lists a great deal of side effects, correct?
Yes.
As far as some of the side effects that would be most obviously visible just from the naked eye, it lists fever, nausea, correct?
Well, I'm going to sustain the objection to the form of the question. What Ms. Lee may have discussed with Mr. Jackson is another issue. You may refine the question.
Did you advise Mr. Jackson of some of the outward physical symptoms that can result from using propofol or Diprivan?
Yes.
And was some of those dizziness,
Yes.
agitation,
Yes.
chills,
Yes.
delirium,
Yes.
shivering and trembling,
Yes.
twitching,
No, I didn't.
fever?
No.
And you noted it when you reviewed the physician's desk reference, you concluded and advised Mr. Jackson, again, that it could be very dangerous used in the home setting.
Yes. Can I say
Yes,
something?
did you need to explain an answer?
Yes.
Please.
As I was going through all the symptoms, one of the symptoms was memory loss. And I knew I was working with a great entertainer, and I said, what if you start forgetting your lines? Actually, I had written that out. And he said, I would never forget my lines. And he didn't too much want to listen to all the other symptoms. He just kept telling me that doctors told me it would be safe.
And in fact, you note in your medical records, after going through the physician's desk reference with Mr. Jackson, you indicated to Michael Jackson, I understand you want a good night's sleep. You want to be, quote, and you use, quote, knocked out. But what if you don't wake up? Correct?
Yes.
And he responded again, I will be okay. I only need someone to monitor me with the equipment while I sleep.
Yes, that's exactly what he said.
You want a moment, Ms. Lee?
Yes, please.
By all means, take a moment.
Can I just say something?
Nope, that's okay. You just answer the question. Thanks. Ready to resume?
Yes.
Mr. Walgren?
Thank you, Ms. Lee. Those are the words Michael used and the words that you noted in your medical records?
Yes.
Thank you, Deputy John.
Thank you.
Now, that evening, then, again, April 19th, you did stay into the night for the purpose of watching and noting Michael Jackson's sleep pattern, correct?
Yes.
And again, I'm referring to your progress notes of that day, reflecting the evening time. You say that by 12:15 the patient was asleep. Approximately 3 hours later, he woke up upset, telling me, see, I only need Diprivan IV, correct?
Yes.
Please find me a doctor. And you explained again, this is not safe. And he tried to assure you that he would be safe as long as a doctor would be with him and monitor him while he slept with the IV drip, correct?
Yes.
You were not willing to give Michael Jackson the propofol or Diprivan or IV drip, correct?
Absolutely not.
That's absolutely correct?
That's absolutely correct, yes.
Because what you had learned is that it could kill him potentially.
Yes, it wasn't used for home setting, and it wasn't a sleep aid.
And after this meeting and your observations and the conversations you relayed on April 19th, you never saw Mr. Jackson again, did you?
No.
Mr. Chernoff referred to your interview. Do you recall being interviewed by the police on July 9th, 2009? And in July 2009, were you interviewed by the police?
Yes.
And in that July 2009 interview, you relayed to the police that you told Michael Jackson, in response to his request for propofol, quote, no one who cared or had your best interests at heart is going to give you this.
Yes, I did tell him that. Yes.
Thank you. Nothing further, Your Honor.
Mr. Walgren, thank you. This is redirect examination. Mr. Chernoff?
Just a couple of questions.
Thank you.
Ms. Lee, prior to talking to the police, did you give any other interviews? Did you talk to anybody else about this prior to talking to the police?
Yes.
Okay.
Prior to?
Yes.
Yes.
Who? Who was it?
Prior to speaking to,
The police?
yes.
Okay. Who?
I did have I had interviews, yes.
Okay. With who?
Larry King, and several others.
Several other media outlets?
Yes.
Okay. Can you tell us how they contacted you?
Overruled goes to witness's state of mind. If you know, you may answer.
Can you tell us how they contacted you?
I have quite a few patients. One is a PR person, and she had a relationship with an outlet, and that's how it started.
And then you talked to the police?
Yes.
Okay. I want to ask you about June 21st, when the morning you received that call from Fahim Muhammad.
Yes.
Can you tell us about what time that was?
It was sometime in the morning. I don't know exactly. I was out of town.
Was it early in the morning?
Objection vague. I think she said she was out of state, so what time are we talking about? Her time or?
Overruled. You may refine the question or follow up. Mr. Chernoff?
Was it early in the morning?
I don't remember. It was,
Before 10 Florida time or after 10 Florida time?
I really don't remember.
Okay. Were you woken up by the call?
No.
Where were you when you got the call?
I actually was overly exhausted, so I was in the ER myself as a patient.
Did you go to the ER in the morning?
It was in the morning.
Okay.
Yes.
Okay. Thank you. That's all I have.
Chernoff, thank you. Cross-examination, Mr. Walgren.
No, thank you, Your Honor.
May Ms. Lee be excused, Mr. Chernoff?
Yes. Thank you.
Mr. Walgren?
Yes, Your Honor.
Ms. Lee, I want to thank you for your testimony.
Thank
Please
you.
don't discuss it or the facts of the case with any other witness until we finish the trial. You may step down. You may leave.
Thank you very much.
Thank you. Thank you, Deputy. Mr. Chernoff, you may call your next witness.
Amir Dan Rubin, Judge.
Thank you.
Sir, please stand and raise your right hand. Please stand and raise your right hand. Do you solemnly state that the testimony you may give in the cause now pending before this court shall be the truth, the whole truth, and nothing but the truth, so help you God?
Yes, I do.
Please be seated. Please state your name for the record. Spell your first and last names.
My name is Amir Dan Rubin. A-M-I-R is my first name. Rubin is my last. R-U-B-I-N.
Mr. Rubin, good morning.
Good morning.
Let me provide you with instructions which I give to every witness in every case. The first of which is to please sit back and relax. The second of which is to speak loudly so we can hear you. You may want to scoot up a little closer to the mic, although you don't have to speak right on top of it. The third is to answer questions yes or no if called upon to do so, rather than using slang. And the last is to wait until you hear an entire question before you even start to answer it, even though you think you may know the question. Wait so we don't have people speaking over each other. Is all of that okay?
Yes.
Thank you. Direct examination by the defense. Mr. Chernoff.
Thank you.
Thank
Mr.
you.
Rubin, how are you?
Good. Thank you.
Thank you for coming. Do you live in Los Angeles?
No.
Okay. You're up north?
Correct.
Okay. What do you do for a living, Mr. Rubin?
I'm a hospital executive.
Okay. Any particular hospital?
Stanford Hospital.
All right. And what do you do as a hospital executive?
I'm responsible for the operations and maintenance and functioning of the medical center.
Now, on June 25th, 2009, were you also a hospital executive?
Yes.
What did you do and where did you work on that day, June 25th, 2009?
I was the chief operating officer for the UCLA hospital system.
All right. What were your responsibilities as chief operating officer?
I was responsible for the operations of our hospital systems, our multiple hospitals and clinics.
Okay. Tell us, can I, let me, can you give us you work for UCLA Medical Center, is that right?
Correct.
And this is in Los Angeles?
Yes.
Okay. And could you give us a quick layout of the,
Mr. Chernoff's conferring with Ms. Brazil.
Michael, to look at. Could you give us a brief rundown, Mr. Amir? Can you give us a brief rundown on the layout of UCLA Medical Center as it existed 2009, June 25th, 2009?
Sure. The medical center is a multi-story hospital with an emergency department on the ground floor, as well as administrative areas, dining commons, basement level that has an auditorium and laboratory and support services, an operating suites on the second floor, and inpatient units on the floors above that.
Give us an idea of the it's not just one building, is that right? There are actually several buildings attached to each other?
Well, the inpatient unit is functionally one building, but there's a series of buildings on the campus, including research labs, classrooms, and outpatient buildings.
Where was your office located in the building?
My office was in the administration area, which is on the first floor, the entry-level floor, lobby on the west side of the entrance of the ground floor of the hospital.
This is commonly known as the west lobby area, or how would it be described by UCLA?
Yeah, it would be the west lobby. There is a children's welcome wall for our children's hospital, so sometimes it's referred to the children's hospital entrance, but it's on the west side of the lobby.
Okay. And where is the emergency room compared to where your office is in the west lobby?
The emergency room was through some doors and some hallways, probably a couple hundred feet north of the administration suite.
And how would one go about getting into the emergency room from the west lobby? Do you have a remembrance of that?
Sure. You would walk through a lobby, enter through some doors, and you would be presented into the emergency room waiting area.
Is it possible to go to the west lobby from the emergency room by exiting the emergency room in the outside and taking the sidewalk to that area?
Yes.
And how would you go about doing that?
There was doors to the outside from the emergency department and the administration suite, and it's an easy way to traverse as well.
I want to direct your attention to June 25th, 2009, and see if you remember an event there involving the death of Michael Jackson. Do you remember that day?
Yes.
All right. Were you working on that day?
Yes.
All right. And you were working as the COO?
Yes.
All right. And when did you first learn that Michael Jackson had been brought into the emergency room at UCLA?
I had been called from the emergency department and was notified that we had a person of interest and that my assistance might be needed. And he had already been there at the emergency department. The medical team was already doing what they were doing, but I had come over to see if I could help.
Is this a frequent occurrence when you receive a call of a person of interest?
Yeah, or any issue of interest. As the chief operating officer, I get probably hundreds of emails and many calls a day on all kinds of things that are happening. So,
When you were told there was a person of interest, did they tell you who it was?
not over the page, no.
Okay, but they did tell you where it was.
Yeah, when one of my team members says, I think you should come down here, I usually listen to him.
Okay. And that you went to the emergency room at that point?
Mm-hmm.
Okay.
Yes.
What did you see when you got to the emergency room?
Well, from the emergency department perspective, the emergency department was functioning routinely. Physicians and nurses were taking care of patients and staff, and I was not in the clinical areas per se involved with that. So,
Could you give us some idea about the time on the 25th when this occurred?
When what occurred? When he
When you-
actually arrived?
When you went to the emergency room?
I don't recall the precise time, but it was in the afternoon.
Was it before 4? Was it immediately when they brought Michael Jackson in?
No,
Do you know?
no. He was already in a patient room, a trauma room, with staff. I did not go into the room, wasn't there, but so it was after that had occurred.
Okay. What did you happen to look inside the room? Did you happen to see the activity that was going on inside that
No.
room? What did you observe outside the room? Did you see anything that was going on outside the room?
Well, we wanted to make sure we secured the area for privacy purposes and from security purposes. So those were some of the things that I was involved with.
And the security purposes to keep people from coming in, onlookers, that type of thing?
Correct.
And what did you do in response to that? How did you secure the area?
Well, we had security forces, internal, and then called for broader security from campus police and LAPD. We made sure we had privacy shades up covering various window areas. And then eventually we tried to move any additional people who had come in with the event to other areas.
Now, there were people that came in with the event in this case, is that right?
Well, I can't say who came in during the event because I came afterwards, but there was people there when I arrived there.
Were there people that you remember, names that you remember?
There's people whose names I know after the fact, but not at the time did I know who people were.
All right. Who is it that was there when you first came to the emergency room?
Oh, well, when I first came, likely there was security type people. I presumed from Mr. Jackson's staff, security staff, I presumed.
You identified them as security.
Overruled. You may answer. You
Um,
presume that they were security people?
I presume so, with earpieces and the like. And there was other people, but I didn't per se know who they were.
All right. Did you see any family members at that time?
Later on, there were family members. I can't exactly recall
Okay.
exactly how much later, but
And during that period of time when you first came to the emergency room, did you see Dr. Murray?
I don't recall seeing Dr. Murray when I first arrived there. I didn't know Dr. Murray was Dr. Murray. I didn't know who anybody was.
Right.
In retrospect, I recall having seen him there briefly as I saw other people there.
All right. How long would you estimate you stayed in the emergency room working this particular issue?
Oh, well, probably initially I would say 45 minutes or so, and I was moving back and forth between the emergency department and then other parts of the hospital, coordinating with other parts of our team in terms of security and media and conference rooms and the kind of things that we're clear were going to be needed.
Explain what you were doing with regard to your need for conference rooms. Why did you think that there was a need for conference rooms?
Well, we wanted to have, in the medical area, we try to not have a lot of people back there. So as people were gathering, we wanted to make sure that that was outside the medical area, and also to have privacy for family.
All right. And did you arrange for these conference rooms?
In conjunction with the folks in the emergency department and my administrative team,
Okay.
yes.
And just one conference room or more than one?
I believe we had one conference room for police. I believe we had one for family. Those were behind the emergency department. And then we used a conference room by our administration area, our board room for others not directly involved.
All right. Now, this conference room by the administration area, this is in the west lobby area?
Correct.
Is that right? At some point during this process, was there a meeting held in this conference room to discuss a press release?
Yes.
Okay. And who was present in that conference room during that conference? Do you recall?
And I wouldn't say it was a formal conference. The CEO of AEG Live, who I'm not recalling his name, but I recall him giving me his business card, and a gentleman who was with public relations with AEG were working on a press release. Our head of PR at UCLA was there to assist, and at some point in the process, Mr. Jermaine Jackson was there involved as well, and there might have been others in and out of the room. I wasn't per se statically staying in that room, so I'm not exactly sure who in total was there, but those were some of the people who were involved.
You were back and forth from that room?
Back and forth from that room, the administration, checking on the emergency department, checking on the lobby, checking on security at the doors, checking what's going on with media.
During the period of time that discussion was had about this possible press release, do you know what time it was?
Well, it was certainly after the time I had been in the emergency department initially, maybe an hour and a half later.
Was Michael Jackson already pronounced dead?
I don't know. I wasn't involved with the clinical process.
The press release that was ultimately released announced that Michael Jackson was dead, though, right?
If that's what it says, I wasn't involved in writing it, so I would just know that just as anybody else would.
At some point, the press release was given somewhere in UCLA Medical Center?
Yes.
And where was it given?
It was in the basement area. We had an auditorium, there.
And the press release was given by whom? Press statement was given by whom?
Mr. Jermaine Jackson.
All right. This is Michael Jackson's brother.
I believe so, yes.
All right. During this period of time, while there's discussion about this press release in the conference room, first of all, do you recognize this man, Dr. Conrad Murray?
Yes, I recognize Dr. Murray.
Indicating Dr. Murray.
During the period of time while there was conversation about this press release, did you see Dr. Murray?
Briefly, yes.
All right. Where did you see him?
I believe in the conference room.
And when you saw him, what did you observe him to be doing?
I believe the AEG PR people had copies of the press release, and a few folks were reading it, and I believe he looked at it as well.
Do you recall him making any comment after looking at it?
Yes, I believe there was some comment in the press release, something to the effect of potentially stating the reason for death, and I believe he stated, it's not known at this time.
So you do recall the press release talking about the cause of death?
Yes, I recall people talking about that as it was handed out.
Do you remember Dr. Murray's demeanor during this period of time? Do you remember how he appeared to you?
Again, maybe at that point I had known he was a physician, but I didn't really differentiate him from anybody else. He was wearing a T-shirt and jeans. And
Physically, he was dressed in T-shirt and jeans. What about...
Yes?
yes,
Did he appear to be emotional to you?
well, certainly, I guess I would say looked distressed as was the mood there.
And that was pretty much shared by everybody in the conference room.
Yes.
All right. You talked about the CEO of AEG Live being in this conference room. Does Randy Phillips, the name Randy Phillips, ring a bell?
Yes.
Okay. Thank you very much. That's all I have.
Mr. Chernoff, thank you. Cross-examination by the people. Mr. Walgren? Thank you.
Good morning, sir.
Good morning.
Mr. Chernoff made some inquiries about the demeanor that you observed on Dr. Murray. Do you recall telling the police specifically about how Mrs. Jackson, Michael Jackson's mother, was notified about the death of her son?
Yes.
And you told the police that you observed the doctor, Dr. Rochelle Cooper, walk into one of the exam rooms to tell the mom that her son had been declared deceased, correct?
Presumably that's what she was telling her. But yes, I did observe Dr. Cooper going into a room with Ms. Jackson.
And shortly thereafter, as you stood outside the room, you described that you heard the anguish of a mom hearing about her child. And from a personal perspective, it was just not a good thing to hear. Correct?
That's correct.
And that's what you observed about demeanor of Mrs. Jackson.
Yes.
Thank you.
Thank you.
Mr. Walgren? Thank you. Redirect exam, Mr. Chernoff?
No, thank you.
May Mr. Rubin be excused, Mr. Chernoff?
Yes.
Mr. Walgren?
Yes, Your Honor.
Thank you. Mr. Rubin, I want to thank you for your testimony. Sir, please don't discuss your testimony or the facts of the case with any other witnesses until the trial is concluded. You may step down. You are excused, sir. Thank you.
Thank you.
May I see counsel? Thank you. Mr. Chernoff, please call your next witness.
Defense calls Randy Phillips.
Ladies and gentlemen, because of our schedule, in an effort to try to make up a little time, I've suggested to counsel that we right now, you may have to wait a little while to get the lunch on this end, but I know how quickly you eat. So if we're going to be in recess till 1, I'm sure we could be having you eat at 12:55 and you'd be ready because you're just remarkably prompt at eating. But would that be all right with your schedule? Yes, sir. We break at 11:30 and come back at 1? Alternate 1? Sure. Do any of you have to use the facilities for a few moments? I always invite you, so go ahead. Alternate number 1. Carefully, please. Thank you. I'm advised. Lunch is already here. Don't tell alternate number 1 when she comes back. I did a little note, a little post-it. Mr. Phillips, you can just have a seat for a moment rather than be standing. Thank you.